Dr. Emily Carter addresses a delicate topic, one men rarely discuss out loud but often carry in silence, especially after age 50 or 60, the feeling that the penis is getting smaller. Yes, it can happen, and many patients come to her office feeling insecure, confused, even embarrassed by what they're experiencing. Her first message is simple: there's nothing to be ashamed of. This is a common medical issue, and men deserve clear, straightforward information. With time, it's possible for penile size to diminish. Uncomfortable as that may be to consider, understanding why it happens is crucial. The human body changes with age, and circulation, directly affecting penile tissue, is one of the most impacted systems. In many ways, the penis behaves like a muscle. It needs frequent use to stay active, strong, and functional. When erections become less frequent or less firm, the tissue weakens, loses elasticity, becomes less responsive, and can gradually atrophy. It isn't just aging, specific causes can accelerate or worsen the process, and knowing them is key to prevention or reversal. One of the main drivers is erectile dysfunction. When a man goes a long time without full, vigorous erections, the penis stops receiving necessary stimulation. Think of a musical instrument stored away for years, the strings rust, the sound dulls. Penile tissue needs movement, expansion, and contraction. Without it, vitality fades. Silent contributors often include chronic health conditions. Diabetes and cardiovascular disease significantly impair microcirculation. Because the penis relies on very small blood vessels, it's often one of the first places where reduced blood flow shows up. Dr. Emily Carter explains that diabetes quietly damages the tiny blood vessels that supply the penis, limiting oxygen and blood flow, and without blood, tissue health declines. When that vital supply drops, tissues weaken, respond less, and the change can show up in both function and size. Another frequent factor is obesity. Excess fat around the lower abdomen and pubic area can make the penis appear smaller because it's partially buried under that fat pad. It isn't only visual, obesity also impairs circulation, which worsens the problem. Certain surgeries can leave a lasting imprint too. After a prostatectomy, surgical removal of the prostate, men may notice a slight retraction. Scar tissue can form during healing, altering the apparent length and sometimes affecting function. These are real documented causes seen in many men as they age. But she stresses something vital. All is not lost. Men can recognize changes early and take action. Next comes how to tell if this is happening and what to do to keep it from progressing. How can a man know for sure if his penis has truly decreased in size? Many notice a visual change but don't know how to measure correctly, leading to worry and mistakes. For a reliable, accurate measurement, it should be done at full scenes. Erection: use a ruler or tape measure along the top of the penis. Press gently into the pubic bone, just above the base. Measure from there to the tip of the glans. That's the most dependable way to record size. If not erect, another option is to gently stretch the flaccid penis to comfortable full length and measure from the same starting point. In general, a stretched flaccid length is similar to erect length. If there's a prior baseline to compare against, a new measurement can clearly show any reduction. It's also important to note changes in rigidity. If erections aren't as firm, or if the penis looks smaller during erection, those subtleties are meaningful clues. If a decrease is evident, the key is not to panic. The goal is to understand why it's happening, then act. With identification in hand, Dr. Carter turns to what truly moves the needle: practical strategies that can start today to prevent or even reverse this process. First and most crucial, improve blood flow. Penile health depends heavily on healthy circulation. Concrete steps help. Move the body. No marathons required. Daily walking, cycling, swimming, or any light but consistent exercise can make a profound difference. Dr. Emily Carter advises men to stay active at least 30 minutes a day, 4 to 5 days per week. Next, she turns to nutrition. A nutrient-poor diet high in fats, sugar, and processed foods is a direct enemy of circulation. She recommends cutting back on fried foods, processed meats, packaged sweets, and alcohol. In their place, prioritize fresh vegetables, a variety of fruits, legumes, whole grains, and lean proteins like fish or chicken. These foods help keep arteries clear, improving blood flow throughout the body, and including to the genital area. Another key point: strict control of chronic conditions. If diabetes or hypertension is present, they must be managed closely. It isn't enough to take medication now and then. Men should follow treatment precisely, get regular labs, and keep an open line with their clinician. When these conditions slip out of control, blood vessels suffer first, and that inevitably affects sexual health. Her third pillar is to maintain an active, healthy sexual life. Many men gradually set this aside. It doesn't have to mean only partnered sex. There are healthy ways to keep penile tissue active on one's own. Masturbation, practiced mindfully and in moderation, stimulates tissue, supports circulation, and helps maintain erectile function. She also notes that penile vacuum devices can improve local blood flow, but stresses one crucial rule: don't use them without professional guidance. Incorrect or unsupervised use can cause permanent harm. If there's curiosity about these tools, a urologist can provide safe direction. The fourth essential step is to address erectile dysfunction early and directly. If erections feel weaker, less frequent, or shorter lasting, don't ignore it. Don't let embarrassment block care. Thousands of men deal with this silently every day, yet there are multiple effective, discreet treatments, from targeted medications to clinician-directed hormone therapy and technologies such as low-intensity shockwave therapy, LIESWT, that stimulate blood vessel regeneration in the penis. These approaches can restore erectile capacity and, by reactivating tissue elasticity, may help regain some size lost over time. Before going further, she emphasizes a vital point: no advice replaces a specialist consult. If there are doubts, seek professional guidance. A urologist or andrologist has the training to tailor solutions responsibly to a man's specific situation. Every body is different. What works for one isn't always ideal for another. Now that men have tools to identify true change, understand common causes, and know the first actions to take, Dr. Carter invites them to go deeper. There are practical, effective, realistic solutions they can start today. No one has to face this challenge alone. There are real ways to improve, regain confidence, and feel whole again, if they choose to act and seek proper support. She then presents a detailed, simple, step-by-step plan designed to preserve pineal health and strengthen sexual well-being comprehensively. It requires no complicated gear, just commitment and consistency. Step 1. Improve circulation in the genital region. Good circulation is, without exaggeration, the most important pillar for preserving penile size and vitality over the years. The better the blood flow to that area, the greater the chances of maintaining not only firmness, but also the organ's natural dimensions. To begin, walk 30 minutes a day. Dr. Emily Carter notes that the pace doesn't have to be brisk. Consistency matters most. Daily movement stimulates overall blood flow, especially to the pelvic region. She suggests adding gentle bodyweight squats and stretching. These movements activate key muscle groups, including the pelvic muscles, which play an essential role in directing circulation to the genital area. Step 2. Put the right foods on the plate. Some foods are true allies for circulation. Beets and watermelon contain natural compounds that boost nitric oxide, the molecule that opens blood vessels and improves flow. Nuts like walnuts and almonds provide heart-healthy fats that protect arteries. Don't forget omega-3 rich fish such as sardines or salmon, which help keep vessels flexible and healthy. Just as important is avoiding what harms circulation: excess sugar, processed sweets, saturated and fried foods, heavy alcohol, and tobacco. Each one obstructs blood flow and directly affects intimate health. Step 3. Reduce excess weight. If abdominal fat is present, losing it will improve overall health and can also make the penis appear longer by reducing the pubic fat pad that hides it. Less fat in the pubic area means more visibility and better function. A balanced diet is best. When possible, consult a nutritionist for personalized guidance. Pair this with consistent aerobic exercise, walking, swimming, or cycling. Consistency drives results. Step 4. Break a dangerous myth. Thinking that infrequent sexual activity doesn't matter is misguided. Like any tissue, the penis needs regular stimulation. If it isn't used, it weakens. Even without a partner, it's important to keep tissue active. Healthy, moderate masturbation supports elasticity, circulation, and erectile function. With medical guidance, penile vacuum devices can also promote local blood flow, but only under a clinician's direction, since improper use can cause harm. Step 5. Treat erectile dysfunction early. Leaving ED unaddressed can have serious consequences, including real reduction in penile size. If erections are weaker, less frequent, or shorter lasting, don't ignore it. The earlier the evaluation, the easier it is to reverse course. Today, there are multiple safe, effective options: medications, low intensity shockwave therapy, laser therapies, and hormone replacement when indicated. These approaches can restore erectile capacity and, by reactivating tissue elasticity, may help recover size lost over time. Step 6. Get regular medical checkups. Routine visits to a urologist, especially after age 50, can make a major difference. Consider assessments like penile Doppler ultrasound, hormonal labs, and related tests that anticipate changes in penile function and circulation. Prevention beats correction. Step 7. Protect emotional health. Many men underestimate how much mindset influences sexual life. Anxiety, stress, low mood, or poor self-esteem can deeply affect performance and self-perception. Sharing concerns with a trusted person or a professional can lift long-carried burdens. Seek ways to unwind: meditation, yoga, or a hobby that brings joy. She emphasizes one more truth: if someone is going through this, they're not alone. Thousands of men feel the same, and many have improved once they sought help and followed sound guidance. Self-worth, confidence, and well-being aren't defined by size, but that doesn't mean a man can't care for this part of his health with dignity and commitment. Dr. Carter closes with gratitude for the trust shown in reading this far. She encourages sharing the information with someone who might need it, leaving questions or experiences in the comments, and above all, taking care of health, because it's the most valuable asset a person has, and everyone deserves to live each stage of life fully.